Welcome to Voice for Infection Prevention, where we explore the latest developments, challenges, and insights in the field of infection prevention and control. With a passion for promoting patient safety and healthcare excellence, we're excited to bring you engaging discussions with experts, leaders, and innovators in the field. So, whether you're a seasoned professional or just beginning your journey in infection prevention, welcome to the conversation. This is Voice for Infection Prevention.
Welcome back to Voice for Infection Prevention. Today I'm joined by Jennifer Cox, an infection prevention leader whose career journey is such a great example of how this field often finds people gradually and then continues to challenge and shape them over time. Jennifer's path into infection prevention started with an early interest in microbiology, then grew through bedside nursing, a small hospital experience, and years of learning the profession from the ground up. What makes her story especially meaningful is the way it reflects so many realities of this work. Stepping into the role before you feel fully ready, learning through curiosity and persistence, building confidence over time, and continuing to grow through new environments, new responsibilities, and new leadership challenges. In this conversation, Jennifer shares what it was like to begin in a small rural hospital with limited resources, how she developed as both an infection preventionist and a leader, and what she's learned from working across community settings, large health systems, and now an academic medical center. We also talk about mentorship, certification, professional involvement, team design, and what qualities like humility, curiosity, and a willingness to keep learning matter so much in this profession. If you're interested in career growth, leadership development, and the kind of mindset that helps people succeed in infection prevention over the long haul, this is a conversation you won't want to miss. Now, let's dive in.
Cool. All right. Well, thanks for hopping on. I'm going to start off just kind of how we do most of these, but I'm really curious for all of you guys, just how you discover infection prevention as a career. And it seems like most people kind of fall into it or accidentally come across it. And based off your resume here, it looks like you went to nursing school but started off as a CNA. So it sounds like you probably have a very similar story. But I'm curious, how did your early years in healthcare go? And then what was your first exposure to infection prevention?
So my exposure may be a little bit unusual. So when I was working on my prerequisites for the nursing program, I took a microbiology class and I really loved it. And my microbiology professor shared with us information about an infection preventionist infection control nurse, right? At that time, that was the term, in Australia, in kind of the early days of MRSA, like the challenges with MRSA in the hospitals. And so she was having an MRSA outbreak in her burn unit. And the story kind of described, how she went about identifying what was happening and how it was being transmitted and the different strategies she used to try to prevent the transmission and keep the patient safe. And I knew I was going to nursing school, but that seemed very unattainable to me, right? Like that's something that you do when you're like a very experienced nurse. And so keep it in the back of my mind. That sounds really cool, but that won't be my reality for a while. So then, when I was in nursing school, I started working as a CNA so I could get some experience taking care of patients and kind of grow on what I was doing in my clinical rotations. So then graduated from nursing school in 2000 and started working as a med-surg nurse and made the unfortunate mistake of sharing with my charge nurse that I usually worked with at the time, night shift med-surg, that I thought infection control sounded like a really cool job. And, what did she know about it? And she was like, oh, really? You think that sounds cool? You can take care of all the patients in isolation then. So that's what I spent my, first part of my career running around with 10 patients in isolation on my med-surg unit at night. But it didn't deter me. So, so I eventually moved from that hospital and started working in another hospital, small hospital in the ICU, and was really enjoying that. And out of the blue, the infection control nurse at the time approached me and said, I understand you're interested in infection control and I have an offer for you. she wore multiple hats. We were in a small rural hospital. And so she needed to give something up because the administration wanted her to take on an additional role. And so she heard about this ICU nurse on the night shift who was interested in infection control. So came and talked to me about it. And so it kind of dropped into my lap, and I didn't want to turn it down. I didn't want to say no. So it was a really small hospital. So I worked part-time at night in the ICU and then part-time during the day, trying to figure out what I was supposed to do as the infection control nurse. So thankfully I had her to help me through that process, and she trained me and kind of taught me what I needed to know to try to learn how to function in this role. It was a lot to learn to know. A lot of things you don't learn in nursing school, right? So it was a big curve. But it was a great start, and I'm thankful to her for reaching out to me and asking me about that. So then I eventually left the bedside and was doing, still in that small hospital, part-time infection prevention work, and then part-time with the quality department doing performance improvement, quality reviews and that type of thing. So then eventually left that hospital and moved back to Southern California, and was able to continue working in infection prevention in another little hospital in Southern California, but not quite as small. We increased from an average daily census of 30 to about 100, and then got a lot of additional experience with employee health and workers' compensation and peer review and risk management, and just, in a small hospital, you wear a lot of hats. So I wore a lot of hats in that place and learned a lot. And did that for about 5 years, and then had an opportunity to move to a hospital as part of a large system in California. So, and I solely was able to focus on infection prevention. So that was really nice. And stayed there for 11 years and learned a lot, so much expertise in that organization, and so much that I was able to learn and pull together during that time. And then after 11 years, moved to my current position, and I've been here for about 3 years.
Okay, excellent. All right, so let's go back in time. Then
Mm-hmm.
your first exposure, you said you're dealing with the isolation unit, and you kind of mistakenly got put in there, or hesitantly got put in there. How much exposure did you have to true today's infection prevention in that role? Was it just a piece, or were you pretty involved as the IP there?
In the small hospital when I started doing infection prevention?
Yes.
Yeah, okay, so it was really different, right? It was early 2000s. At that hospital, we didn't have an electronic medical record at that time. So the person who was training me, she had been spread really thin and really wasn't able to keep up with the surveillance. So my first several weeks was sitting in her office with a stack of micro reports that was probably knee high that she hadn't gone through, and a stack of census reports that was much larger than the micro reports, right? And so my first several weeks, maybe months, I don't know, was going through all of those reports that were printed and just waiting for review, and reviewing that against the census report to figure out if this positive culture was something that was acquired, after the third day of admission. And so then set it aside, because these are the cases that I need to attempt to do surveillance on, and I had no idea how to do that. But she walked me through a lot of that in the very beginning, and I read a lot and just learned a lot. So I think I got a good sense of infection prevention as it was at that time, but over the years it has changed significantly. But I got a lot of good experiences there, right? I used to spend a lot of time with the microbiology tech, because I loved microbiology when I was in school, but I wasn't very proficient with it, right? It was just of interest. And so she was a wealth of information. So I would go down to the lab to pick up my paper micro reports and sit in the lab with her and go through it and tell me about this bug, tell me about that. What do you think about this? So I learned a lot from her. She was a really tremendous resource. And actually, I think was the first time I started, maybe going back to those experiences with her, once I was in a position where I was, leading a team and could make decisions about who I wanted to hire, that knowledge was so valuable to me, and how valuable that would be to add that knowledge base into a team once I was able to, not be the sole practitioner in a little hospital, but to have a
Right.
team, to balance out kind of the nursing background and nursing knowledge. So, yeah, I got some construction experience at that little hospital, and a lot of things that, you just don't learn in nursing school. So it was
Yeah.
trial and error.
Yeah. Did you have any moment? I know a lot of people kind of get into the role and then are very just surprised by just the breadth of the role and kind of what you're
Oh, yeah.
over. Was there any kind of light bulb moment where you're like, oh, wow, I did not realize this would be part of my purview?
Yes, very much so. I mean, I didn't really know exactly what I was getting into, right? I knew that it was kind of like being a, infectious disease detective sort of thing, right? I gathered that from what I had learned when I was in my micro class, but I had no idea the depth of knowledge that you need to have. So, I hadn't spent a whole lot of time in the operating room, but we were having surgical site infections. And so what goes on in there that, could be contributing to this, or that we can work on to prevent these outcomes from happening. Certainly the first time I had to put a hard hat on, that was not what I was expecting, right? That would be part of my career. So, yeah, there were a lot of moments where like, oh, this is part of it too. Oh, okay, well, let's go, figure this out. And asking a lot of questions, and I became very comfortable with saying, I don't know, I haven't seen this before, I haven't been exposed to this before, so tell me more about it, from whoever I was talking to get their perspective on it, so I could learn. I really had to be a sponge.
Yeah, and it sounds like you had a pretty good mentor in place
I
there,
did.
from the biology side. But often you see, especially the smaller hospitals, like you have to be connected to other IPs and you have to kind of just figure it out. So how did you, I mean, outside of your mentor, what were your kind of ways just to learn and educate yourself in that and different areas?
Yeah, I read a lot, as much as I could. So I was in Northern California at the time, about 5 hours north of San Francisco, almost to the Oregon border on the coast. And the closest APIC chapter was about a 4 hour drive each way. And that was before the time of, Zoom and whatever. And so
Right.
I was a member of that chapter, but the meetings were not accessible to me. I mean, I would have had to take a whole day off work and drive, 8 hours to go to the meeting. And so really it would have been 2 days, because they were longer meetings. And so that wasn't something that was accessible to me at all. So when I was actually looking at leaving that area and moving back to Southern California, that was one of my goals, was to get connected to an APIC chapter that I could actually attend in person and meet people and have those resources available. So until that time, yeah, it was a lot of reading and asking questions of my mentor, who was there, who had been in infection prevention for quite a while at that point. There was another hospital in the area, and so touching base with that infection prevention person, about some specific questions that came up. But it was a lot of self-learning. During that time, I was studying for my CIC as well, right? It was at the time where you had to have 2 years of experience to be able to sit for the exam. And there were so many things on that test that I had no practical experience with. And there was no way I was going to have any practical experience at that small hospital. So it was a lot of reading and trying to absorb as much as I could on my own.
Were you able to pass that exam your first
I
go
did.
without having like?
Yes, I did. I studied so much. I mean, so I went through, my bachelor's in nursing. I didn't study nearly as much for anything, even my NCLEX, as I did for that CIC exam. Because it also,
Wow.
like, people knew that I was taking it. And so I didn't want people then to doubt that I had the knowledge necessary, so they would come and ask me questions and rely on my answer. And I didn't want anybody to doubt that I was a good resource for them, right? And so
Yeah.
it was very important to me that I passed that exam. So I did. Mm-hmm.
Nice.
Mm-hmm.
Great. I mean, I don't feel like it's that often where people pass their first go around. So that's impressive.
Yeah, it was
Dealing with
challenging because I didn't have a lot of the practical experience, but I went like door to door everywhere that I could within the hospital, right? Like we had clinics that were close to that little hospital. I wasn't responsible for their infection prevention practices. I gave, the team their flu shots every year. That was the extent of what I was responsible for. But I did just ask a lot of questions and make observations and, kind of spend some time in that space, spend a lot of time in the OR, a lot of time in SPD, just went everywhere that I could in the hospital to try to learn as much as possible. So.
Now, how beneficial was studying for that test and passing it before you were exposed to it in like your actual job? Like, did it really help you going on to a new facility and having that knowledge, or was it a totally different thing, practical versus?
I think it did help, right? Like the process of studying for it really made it very clear to me how much I had to learn. So that was kind of stressful. But once I passed it, it gave me the confidence, right, that I have at least the basic knowledge that's expected for somebody in my role. So like when I went looking for my next position, it definitely was something that was I think a very positive selling point, right? That I was already certified. And so
Yeah.
I think it helped me with the next position and helped my confidence. Each time I've changed jobs, it's to a larger, more complex facility or organization, and I always have that little sneaking doubt and question in the back of my mind, like, do I have the experience really that I need for this next step and for this next setting? And really a lot of it is the same. It's just the scope and the scale that's different, right, as you move into more complex facilities. But the basic practice and the basic knowledge is there, and if you know how to apply it in different settings and different situations, then that basic practice and knowledge has served me well throughout my career anyway.
Okay, when did you feel confident being relied on as an expert? I feel like people give varying answers to that question, but I'm curious, like, when did you feel just like people should be coming to you? I know there's always kind of this self-doubt that goes on.
Yeah.
You don't really know, and there's so much to learn, and I don't feel like anybody ever gets to the point of having like get the feeling that they have it figured out. But when did you feel comfortable with people thinking of you as an expert?
Um, it probably took a good 5 years, right? Like, I would certainly couch my responses with, I'm not entirely certain, but this is what I think, and this is why I think it. But let me go back and verify that I'm on the right track, right? And I'll follow up with you if I'm not on the right track. But I think this is the direction that we should go. So I did a lot of that, and then about 5 years in, I felt more like I had encountered more situations, and I certainly felt, a little bit more comfortable. But I check myself still now at this point in my career, right? Like I don't know everything. I'm acutely aware that I don't know everything there is to know about infection prevention and how to apply it in different settings. And I think it's a really healthy approach, or it has worked anyway for me to pull together my historical knowledge. And this is, based on what I know and what I've seen, I think this is the answer. This is the direction to go, and what to take into consideration, but always being open to what other information is out there that I may not be thinking about or be privy to at the moment, right? And so I think that
Mm-hmm.
that desire and comfort with always asking questions and always learning, and never assuming that I absolutely know 100% this is the best way to go, right? There are different ways to go about solving problems. And so I'll apply my experience and my knowledge in that situation that I think is the most applicable at the time. But there's always room for learning and growing. And that really became very apparent to me once I had a group of infection preventionists who were reporting to me. Then we had this like pool of knowledge and experience to tap into, right? And that was really a game changer for me, right? Going from being a sole IP for many years into having a team to lead, which, of course made me check myself at first, right? Like, do I have the knowledge to even lead this group? Like, what am I doing in this role? But I did, right? I mean, we sorted through it, and I did. I had had enough experience at that point, and again, it solidified when I moved into that role. It solidified that I had a good foundation, and a lot of infection prevention is very similar. The issues, the challenges, the concerns, the goals are very similar. It's just the scope and the scale that grows as you are in a larger, more complex organization. So but I think the benefit of having other IPs to tap into and be able to approach something with a collective knowledge and collective experience is really valuable.
So tell me, okay, so you operated as a sole preventionist for several years, and then jumped into a director level position with people reporting to you. Is that correct?
Yeah.
Is that how that?
So when I was at the little rural hospital, I didn't have anyone reporting to me at that time. And then when I moved to Southern California to, again, a small community hospital, I didn't have any infection preventionists reporting to me, but I was responsible for other functions in the hospital. And so over the course of 5 years there, it grew where I did end up with another infection preventionist who was reporting to me, and then some other subspecialties as well, right? Because I had employee health and for a while workers comp and all kinds of different quality and peer review and that type of thing. So I ended up with direct reports by the time I left that organization. So then
Gotcha.
when I transitioned then to my next organization, I only had infection prevention. And at that time, there were two IPs in the department who reported to me, and one administrative analyst role that reported
Great.
to me. Mm-hmm.
Great. Okay. When you first moved from sole preventionist up to where you're managing people, other departments, and all of that, which is great. What do you remember? What motivated that decision for transition at that point?
I just wanted to learn more and grow more, right? I mean, I was a sole practitioner in a really small rural hospital, and I knew there was more out there, more excitement and more to learn. And so I really wanted that growth. I wanted to be exposed to more and have the opportunity to learn more. So, and we
Yeah.
were, relocating geographically, right? So I was at that point married, and both of our families were in Southern California, and that's where we grew up. So it was time to move back to
So it
Southern
made
California.
sense.
Mhm.
Yeah. Yeah. And you mentioned wearing multiple hats. And I think you probably did that at multiple stops. And I realize things are a little bit different today than they were, but I'm curious your take on, like, can an infection preventionist wear multiple hats? Like,
Well,
there was a time
mhm.
where I was recruiting, and that's probably 10 years ago, but I would present a job and talk, and like the first question out of every infection prevention professional's mouth was, does it cover employee health?
Mhm.
And if it covered employee health, then it was a quick no and moved on. And those, you don't see that included in the job description much anymore.
Mhm.
And I'm quick to tell clients that suggest it, that kind of my background and all of it. But I'm curious your take. Like, at the time, was that reasonable? And then today, is that reasonable? Or do those really need to be kind of separate responsibilities?
I think it really depends on the size of the organization and the resources that are available, right? So, um, like for the 5 years that I had employee health reporting to me, there were some. I mean, it was a heavy workload for sure. So I guess whether you want to wear multiple hats, it depends on how strong your neck is and how how willing you are to have a lot of the you get pulled in multiple different directions, and so it really depends. I think. What type of employee health experience it is. If it's doing workers' comp and the traditional kind of hospital-based employee health, then that maybe is quite a lot unless you have the appropriate resources to support that. There's a lot of overlap between employee health and infection prevention, so some of that fits very neatly together. Um, so for the period of time that I had employee health reporting to me, it was okay. The workers' comp was challenging because that was not my forte and that was not something that I was particularly interested in. But the employee health components it was manageable, and it was interesting, and so I certainly learned a lot. When I transitioned out of that role in that facility and into a larger system facility, it was separated. which certainly made sense, right? Because I had so many more beds that I was responsible for the infection prevention program. I had ambulatory clinics. There was a lot. It grew quite a bit. And so without enough resources, that would not have been a very reasonable coupling. But I'm glad that I had the background in employee health. I worked very closely with the employee health leaders in the organization. Over the course of the 11 years that I was there, we changed a couple of different directors. But I understood where they were coming from and kind of the language that they speak and the priorities that they have. And there is a lot of overlap between infection prevention and employee health. So it's a really good partnership. And so I think it benefited me having that experience in employee health, and perhaps made me a better partner to my employee health partners.
Okay, I want to talk a little bit about your transition to managing people. So obviously there was a time where you're managing just IP, and then a time we were managing other departments as well. But it's been striking to me that just a management role is so much different than like your standard, especially a sole preventionist position. Mm-hmm. So I'm curious what that change was like for you. I mean, did you appreciate it, being in more obviously you've spoken to how great it is having a team that you can kind of bounce ideas off of and get perspective from. But from like your day-to-day job, was that something that you enjoyed from day one, or was it something you kind of had to grow into?
I think it was something that I had to grow into more. It's extra responsibility to be, directly responsible for other people, and like creating a work environment for those other people that you're directly responsible for. Mentoring and providing feedback is something that I needed to learn how to do that over time. So it wasn't something that I necessarily really sought out specifically, but I did want to be in a leadership position within infection prevention. And so that just naturally, as you move to a larger organization, comes with the responsibility to manage a team as well. So I think I've learned a lot over the years as a manager, and also has changed. Like in smaller facilities, when I was managing people, I also was very much a working manager, right? Like I had my own units that I was responsible for, my own rounds that I needed to do, my own, surveillance responsibilities. It was kind of wearing both hats at once. And as I moved into larger facilities, it was less of the like day-to-day doing the work myself, and then more of a consultative kind of role to the team members who were doing the work. So I still felt very connected to it because I was involved in the day-to-day, but more from an advisory standpoint rather than from the one directly completing all of that work. But then the responsibility changes, right? So I may not be the one directly completing all of that work, but I am the one packaging all of that up and the conclusions up in a way to present to other leaders, to share the information, share the analysis, and make the recommendations for how to proceed with changes and improvements. So that was a learning curve too, right? Now, how do I kind of shift that perspective, and this is what I'm more focused on. And then as my organizations have grown and my teams have grown, the responsibility for leading perhaps a more diverse team. Like when I moved to my current facility, it was a much larger team than I had previously, much larger. And that came with a whole new set of challenges and expectations, right? There were more people asking questions of me and looking for my input. So it was a larger group and still the same number of hours in the day to answer all of the inquiries and be a support to everybody. So that has definitely been a challenge, but also really great benefit because I have a diverse team, right? I have people who are focused on cleaning, disinfection, and sterilization. I have people who are specialists in peri-op, people who are specialists in ambulatory, clinical informatics and analytics. So all of that is under my umbrella. So it's very like I get to switch my focus quite a bit, right? And it's not the what people think of as like the traditional inpatient infection prevention kind of program. So it there's been a lot of change over the years, that's for sure.
Yeah. Well, and tell me this, and you've hinted at it through this conversation, so I kind of want to nail it down. Like, if you were to just start from scratch, build a brand new infection prevention program, and you got to pick like different backgrounds to
Mm-hmm.
have on your team. So not specific to any facility necessarily, but like if you had a team of 5 IPs, like what would their backgrounds be? What would their educational makeup be?
Mm-hmm.
Just in an ideal situation for
Yeah.
you.
So it, so to be able to answer this question now, I think is a very different perspective than answering this question 15 or 20 years ago, right? Because as a profession, we've moved away from infection prevention as just need to be nurses and that's it. And that used to very much be the expectation job description for written that required a nursing degree. So thankfully, as a profession, we've moved past that and it's much more diverse. So I'd mentioned earlier the microbiologist that I worked with in my first job was an invaluable source of information. And was so helpful to learn from and to bounce ideas off of. So I think a laboratory background, an IP with a laboratory background is really very beneficial. I think it balances out the traditional nursing background that many of us enter the field with. So of course, the nursing background too is certainly very helpful. I've had the pleasure of working with some IPs who have medical training in other countries, and the perspective that that brings onto the team, I think, is also really valuable and helpful. So you know, if I had to build a team and I had an opportunity to bring somebody like that into the team, I certainly would want to do that. And then right now, there's such a focus on cleaning, disinfection, and sterilization. And so I have a team member currently who has a background in SPD, and that is his specialty, is doing all the cleaning, disinfection, and sterilization stuff for us. So he's not a traditional IP, but he works with us and, you know, kind of rounds out our team and our knowledge. So I think that background is also really helpful to have. It's a challenge to be the IP with all the information about all the topics, right? And so
Right.
to have a more diverse background amongst the team members, really, it makes us so much stronger because we have different types of expertise that we can tap into.
Cool. And then, I mean, you've been at this now for 25 years or so,
Mm.
give or take.
Mm-hmm.
Tell me, and what's been the biggest challenge of your career? Obviously, infections evolves over the years, but I guess, was there just an incredibly difficult challenge for you, or is there something that's just been a constant challenge throughout your entire career?
Hmm. So I guess the challenges have probably changed over time, right? Like situational challenges. Certainly, COVID was a very challenging time, and I'm sure any IP you ask will say that because of the uncertainty and the really high emotions, and so that was challenging for many reasons. I think throughout the course of my career, one thing that also has been a challenge and has required a lot of very purposeful effort is transitioning from being, you know, a young single person to then, you know, like personally, right, to then being
Yeah.
and balancing wanting to grow my career. And I've, you know, my positions have always been pretty demanding. I don't run the average, you know, 40 hours a week and then I turn everything off and walk away during all of the off hours. So making sure that I'm balancing those demands really well. And then becoming a parent definitely added to the need for that balance and the challenge with that balance.
Yeah.
And, you know, to keep going and wanting to learn and putting the effort and the time into advancing my my knowledge and the challenges that I have at work, and wanting to, you know, continue to pursue new challenges and opportunities. kind of balancing all of life is sometimes very challenging. And I don't know that we talk about that necessarily enough, but it certainly is
Yeah.
something that we should, or I don't know, I do. It's
Yeah.
important. But otherwise, I think, there have been, of course, like situational challenges along the way, but it's interesting. It's fun. Like this job is fun, right? And so there's something new and novel that we need to try to figure out how to approach, and it's good. I don't know. I think it's exciting. I never anticipated when I got into this that there would be so much growth over the decades, so much change over the decades. It's like there's never a dull moment in infection prevention, right? We are always there's a lot of the same that happens, but then there's also there's just so much that changes and grows over time. Um, yeah, I think it's a really exciting career.
You've obviously got a lot to juggle with family and work, and then continue to advance. At some point, you decided to get some additional degrees and to
Mhm.
look at other certifications, and
Mhm.
you've got some extracurricular stuff going on
Mhm.
here. So I want to know, one, how did you navigate that, and then when did you decide it was time? And I guess what initiated those kind of next steps? And so, what all did you do? I mean, I know you went back and got your master's degree to start with,
Yeah.
but you mentioned wanting to be near APIC chapter when you moved back out to
Mhm.
California, and so I imagine there was some involvement in those chapters as well. So, just talk to
Mhm.
me about kind
Mhm.
of the extra stuff that you've done
Sure.
and kind of what caused you to do it.
Yeah. I guess overall, what caused me to do it is I like to grow. I like to learn and try different things. Right. I don't want to be. I certainly like consistency and reliability, but I also I like to try new things and continue to challenge myself. So, yeah. So when we moved back down to Southern California, I immediately went over to find the local APIC chapter and joined that and started attending the meetings really regularly. And that was a game changer for me because I had been by myself, right, and like geographically kind of isolated for the first several years of my career. So it was exciting to be in a room with other infection preventionists and be able to go and be part of that every month. And there were varied backgrounds and experience levels, and it was a really significant part of my growth as an infection prevention to be part of that chapter. Um, and so I got involved in the chapter leadership. So spent several years on the board for that chapter in various roles. And that was also a really great experience from a leadership perspective, right? To learn how
Mhm.
to function in a role like that, or the various roles that I had. And then just from a networking perspective, people who I met at that time who actually have like come around at other points in my career. It's how I'm in the position that I'm in now in my facility now, from someone I met in my very early days in the APIC chapter when I moved down here, who has always kind of been there as a support for me and encouraging me to do different things. So it has been really beneficial. Um, and so, yeah, the decision to go back to school, um, it, well, I jokingly say this with my husband, it was a lapse in judgment because it was a very difficult time. It was during the pandemic, and like the whole world was so different, right? Like he was working from home and not going into the office, and so he was able to be home with the kids, and he said he felt like a war husband, right? Like I went off to war and he was just left like taking care of everything else in the house. Um, which he was, and he did a great job. So maybe around I don't know, 2021 probably, I made the decision to go back to school. And so I was debating, and I'd wanted to go back to school for quite a while, and I just been holding off. And then figured, I like there's no time like the present, so I may as well just pile this on and do this. And so making the decision about what I wanted to study, um, and I ended up choosing a master's in healthcare administration. I wanted something, not nursing, um, and some like a different perspective on the hospital business, right? Because that's the reality, that we're in a business and running a program within a business. And that perspective, I thought would be really helpful for me. I um, don't always think about the implications to the business when I think about what is the right thing to do from an infection prevention standpoint, right, or from a patient safety standpoint. And I think it was a really important marriage of ideas and perspectives for me. So I decided to pursue the MHA, and it took me longer than it was supposed to, because it was hard to stay on track with it, right? Work was very demanding, and so it was very hard. And I didn't actually finish it until I transitioned jobs as well, and so I was in my new organization by the time I finally finished the degree. So I was really relieved when that was completed.
Yeah. Has it been good for you? I mean, the reason I ask is obviously it's always helpful when it comes to finding a new position if you've got some extra letters to your name. But I'm always curious, like the things that you learned, like has it actually been beneficial to your career, or can you chalk it up as, well, it helped me get a new position and that's about it? Or
Um,
has it been like something you would recommend other IPs getting just from a knowledge
Yeah, I
standpoint?
think so. I mean, it kind of challenges our thoughts and our notions. I think when we learn new things, whether that's like a formal, from an educational standpoint, like a new degree, or in an academic kind of setting, or just learning new concepts. In general, I think it kind of challenges our status quo. So I certainly felt that benefit. It gave me some additional insight into like the hospital operations and financial, components of running the business, but then also leadership strategy and change management, and some of those types of concepts that I had been practicing, right? Because I had been in those types of roles, but it kind of formalized some of the knowledge, I guess, and provided a little bit more background, an explanation to what I was maybe already kind of naturally doing. So I think it was a nice supplementation to the leadership and management experience that I already had. So yeah, I think it's totally worthwhile. It's a lot of work. So, that certainly is something to take into consideration. But I enjoyed it while I was in it, and I certainly enjoyed it much more when I was finished with it. So I'm glad I did
There
it
you go.
overall. Yeah.
Nice. Nice. And tell me this too. I mean, you've been in several different kind of facilities and different organizations, which is great. I want to know about the transition to an academic hospital.
Hmm.
Like culturally, was that a big change? Is that significantly different, or is it something that people shouldn't really consider?
No, I think it was certainly a change. So I came from a big system, right? Like I was responsible for the program in one facility, as part of a large system, and a community based system. And I certainly had the benefit of having really great partnerships with the physician leaders in the organization. And that was something that I didn't experience in my prior organizations. Um, and That's certainly complexity within that organization and within my specific facility. But then transitioning into an academic medical center definitely was a palpable difference. The complexity is much greater than what I was accustomed to in my community hospital. Um, the partnership with the physicians is really different because they're faculty, right? So I have the benefit right now of working with two medical directors. They're each devoted to the program half time, for the main academic medical center, and it's a game changer. Like to have that type of partnership and collaboration with my physician partners is really beneficial for so many reasons. Their perspective is a little bit different than mine, so to be able to combine our perspectives is really fantastic. Um, Their experience is really varied from what my experience is. The way that the physicians interact with one another is really beneficial with other physicians outside of the program. And then things are just really interesting, right? Because of the complexity of the organization and the patients that we care for, there are different challenges, right? Like much more vulnerable patients that then lead to bigger infection prevention challenges because we really need to be looking at how we prevent the onset of infection and disease for them while they're in the hospital or undergoing their treatments outside of the hospital. So it adds a very interesting complexity that I certainly have enjoyed, and I underestimated it. I mean, you just don't know what you don't know, right? So going into this, I was like, well, I mean, how different can it be? It's, a few more beds than what I'm used to, but it's some different services, but it is a palpable change, and in a good way, a really good way. It has been These last 3 years have been very enjoyable for me. A lot of work and very enjoyable.
That's great. Okay. And just a couple more questions before we wrap up. And I want to know, I mean, in the role now and really your last few roles, you've been in a position to hire IPs over time. And I'm curious, like, what in your mind makes for a good IP? Meaning, are there any like specific traits or any like personality types where you can just recognize right when you talk to somebody and be like, okay, this is a person that would really like thrive in this career if they wanted to take that step and do it?
Yeah.
What do you look for? What are some of those traits or personality types?
Curiosity, right? The willingness and comfort to ask questions. I think is of utmost importance, regardless of your background, regardless of your experience. When you're walking into a new building and new people, new players, you need to be comfortable asking questions and being interested in learning from a different perspective or in a different situation. So that curiosity and willingness to learn, and then humility. I think that really goes a long way. Being confident in what you do know and what you can do and what you bring to the table, but also being humble about it, right? And being open to different ideas and different perspectives. So when I get a sense of those types of traits, then I like that, in my scoring matrix during an interview, that certainly gains some extra points. Yeah, absolutely. Yeah.
And then I guess my last question that I've got, like, obviously a lot of our listeners are newer in their career and trying to figuring out what it looks like and how they're going to progress. But what would, at this point, kind of looking back on your career, is there anything that you know now that you really wish you would have known or studied or taken time to figure out back early on in your career?
That's good.
I got to save the hardest question for last.
Yeah. I think overall, I've had some difficult points in my career where I've certainly wondered, is this the right choice for me, right? Should I look at doing something different entirely? And so I guess coming out of like the end of some of those tunnels and being able to look back and knowing that it's worth sticking with it, it's worth persevering, it's worth problem solving and overcoming the barriers, because coming out of the other end is satisfying. Like having that additional knowledge or confidence that I can make it through yet another challenging situation, it's really satisfying. So knowing that the point you're at is not the point where you'll end up, and so keep going and trying. And one of my favorite phrases is everything is figure outable. So it's a book, right? I did not coin that phrase, but I constantly remind myself of that. Everything is figure outable. It's hard right now, and we will get through this.
That's great. That's great. Okay. Well, then in closing, I just want to say, is there anything to just say that to people that might be kind of going back and forth as to whether or not this is for them? Do you have any encouragement, maybe people that are just kind of exploring it and trying to figuring out what infection is, to say like, you know what, if you like this and this, I think you should do it, or you know what, it's probably not for you if you think these ways.
So I'll stick with the positive. If you like problem solving and you like diving in to understand what's at the root of something that is happening that you want to affect change on, and you don't mind working really hard and, you know, being in uncertainty a bit of the time, then this is totally the field for you. It probably takes a very special person to do this work and to do it, you know, for decades. But it's really rewarding. And so, yeah, if you like problem solving, then this is absolutely a career to consider.
Thank you for joining us on this episode of Voice for Infection Prevention. We hope you found our discussions informative and insightful. Remember to subscribe to our podcast for more conversations with experts in the field, and don't forget to leave us a review to let us know what you think. For additional resources and to stay updated on the latest news in infection prevention, visit our website at voiceforip.com. Thank you again for listening. Until next time, stay safe and continue your commitment to excellence in infection prevention.